Do I need to change my lifestyle during treatment? So for breast cancer, most of the treatment protocols that are given do not require a major change in your lifestyle. For the first 1 week after chemotherapy, rest may be required, but later on you can go on to perform your normal routine activities. Once a diagnosis of breast cancer is made, there are certain questions you should ask your oncologist. Some of these questions regarding diagnosis: A, is your cancer curable? Second, what is the stage of breast cancer? Normally there are 5 stages of breast cancer, and your prognosis will depend on whether it is early stage or advanced stage. Third, what is the type of breast cancer? So there are a lot of different types of breast cancer. Usually to make a diagnosis of the type of breast cancer, a breast biopsy will be advised, and this biopsy will tell you whether your cancer is triple negative, hormone positive, HER2 positive, and based on this your treatment decisions will be made. Fourth, do I need to undergo any other diagnostic tests before my treatment begins? So once a patient is diagnosed, they feel that treatment needs to begin immediately. It is important to understand that a cancerous lump in the breast did not happen overnight. It usually takes several months for the cancer to reach a stage where it has. It takes about 7 to 10 days to make a final diagnosis and get all the possible information required to treat your cancer. This is important because since the last 10 to 15 years, breast cancer treatment is very individualized. So every patient is not treated the same way. Then there are questions regarding your treatment. How soon should we begin treatment? What are my different treatment options? Normally, breast cancer is treated by 3 different specialists: surgical oncologist, who does surgery, medical oncologist, who will be giving you medications, and radiation oncologist, who will be giving you radiation treatment. Most of the patients will require a combination of these different therapies. It is very important to ask what are the different side effects that will happen during this course of treatment. Some of the side effects are short term, some of the side effects are long term. One of the most common questions we get is, will my hair fall out during chemotherapy? So there are a lot of different chemotherapy drugs. Most of the drugs used for the treatment of breast cancer will cause hair loss. However, there are some patients that will benefit from a scalp cooling mechanism or a cool cap, which can prevent chemotherapy-induced hair loss. The other question most patients have is, do I need to change my lifestyle? It is important to know that most of the drugs used during breast cancer treatment affect your quality of life for a brief period of time because they cause tiredness. There is likely increased risk for infection, and so there are certain changes that you will need to make to your lifestyle, but more or less you can continue doing your routine activities at home. Some patients do go to work. It is okay to take care of children and adults in the house while you're undergoing chemotherapy. It is okay to cook while you're undergoing chemotherapy.